Welcome back, listeners, to Mic Check 2. School is back in session, so it's only right that we have our pediatrics team here today. So I'll allow the team to introduce themselves and kind of let us know what brought them into pediatrics.
Hi, my name is Dr. Okpechi. I started with St. Hope's in 2022. I love pediatrics. I've always wanted to do something with kids. It was either I became a pediatrician or a teacher. So I love to provide care to kids, and it's always a pleasure when you see a kid who was previously sick spring back to life. So that was one of the reasons why I became a pediatrician. But I joined St. Hope because it's a federally qualified health center, and with that, we have the opportunity to provide care to a lot of kids who are underserved, who wouldn't normally have access to like holistic care. So that was one of the reasons why I joined St. Hope.
Nice.
My name is Natoya Caston. I am a family nurse practitioner and also the director of the pediatric program here at St. Hope Foundation. I've been with the organization since 2020. And what brought me into pediatrics is having a family member diagnosed with liver failure at the precious age of 6 months, and seeing all that he went through kind of drew me into pediatrics. And also during like my clinical rotations, I was drawn to the pediatric population, so that's what brought me into pediatrics. I was drawn to St. Hope initially when I did my clinical rotation during my graduate program studies. At that time, I saw all the care and all the services that were offered at St. Hope, and I felt like it would be a great fit for me. So when the opportunity presented itself, I hopped on it very quickly.
Oh, okay. Well, we are glad to have you. Welcome, welcome. Thank you for taking care of our kids.
And as we mentioned, it's back to school time. So
we want to give y'all some insight on just like childcare, and as far as health is concerned. I mean, y'all know there's a lot going on right now in the universe, and we know a lot of parents are a little leery about their kids going back to school, being around other kids. So we just want to give y'all some insight on some healthy tips to keep your kids healthy.
Yes.
For new and current parents.
Yeah, for new and current parents. Me personally, unfortunately, I can't relate too much to this topic, but hopefully with the information y'all give me, I too one day will be ready to be a parent. So hopefully.
Kudos to you.
Same. No kids on this end, but
Team no kids.
Let me take my notes.
So that does bring us into a good question, Sean. What are 3 things that parents should be aware of in regards to their child's health?
So for me, the top three things that I think parents should be aware of is number 1, nutrition. Okay, we want to set a great example for our kids by healthy eating. So making sure they eat from all food groups is a part of maintaining their health. Okay, what goes hand in hand with that, number 2, is physical activity. Okay. We don't want to be sedentary. We don't want them sitting around watching TV, playing video games. So get up, be active, get outside, do enjoyable activities with your kids so that they won't see physical activity as a task that I have to do. And third, child checks. Making sure your child goes to all of their routine health appointments. At those appointments, we address a multitude of things. Some of the most important is growth and development, making sure they meet their milestones, making sure they're up to date on all their vaccines.
So would your top 3 be similar, or do you have any to add to those?
Yeah, pretty much similar. And this question, we can be on this question for like hours today, because pediatrics, different ages, different things. You could have an infant or a newborn, and it's going to be really different from them as opposed to a teenager. For infants, feeding, those are the questions we get a lot. But I would say generally, the first one for me will be the growth. Like Natoya said, you want to make sure your kid is growing appropriately, meeting those, growth milestones, if I should say, then developing appropriately as well, And like Natoya said, that's one of the reasons why we want you to come in for those physicals, because, sometimes as first-time parents, you may not really know what, where and, what they should be doing. But when you come into the pediatrician or your pediatric provider, they can help guide you. So I think that's very important. Then also safety, Safety is very important. We've had a lot of kids drown. We've had kids get injured in the houses, fire, burns, on stoves, even the teenagers who aren't using their seat belts. So, I think those are the top three things. We can talk about this topic for hours, but yeah.
Right.
Mm-hmm.
St. Hope does offer, like we said, we offer a pediatrics. We have a pediatrics team now that we are doing a pediatrics rollout. So if you are a new parent and you don't know where to go, you can always go to offeringhope.org. You can register. Trust me, you're not alone. From something that we had picked up on Healthy People 2030, among children from 0 to 17, 4.1 of them were uninsured. So just because you may be a new parent and you don't have insurance for your child and you think you can't get child care, St. Hope does offer options for you as far as a sliding scales and whatnot to at least get your child adequate child care for health. So I just wanted to throw that out there.
Yeah, just to piggyback off of Sean. So regardless of your income, socioeconomic status, we will see you at St. Hope. So don't be deterred if you don't have insurance. We have a solution for you. We will still be able to see your child and offer vaccines to you at no cost if you qualify for those. So uninsured, insured, you're welcome at St. Hope Pediatrics.
Right. And also, just to add to what Natoya said, we're also working towards getting you and your child in on the same day to get, appointments, so makes it easier for you so you're not like missing so much work. So basically, we're trying to, make care more accessible for you and your child. So that's another reason why you should choose St. Hope's.
So let me ask y'all, what, let's say I'm a new parent, I register for St. Hope, I come in and I see one of you two ladies. What is a typical process as far as my initial child care visits? Like what could I expect?
So upon entering our clinic, you'll be greeted by our friendly people.
Well, not that part. I mean, like, what are y'all going to be? Are y'all going to be poking my kids with needles? Y'all going to be giving all these crazy injections?
Not all the time. We do more.
Right. So it's age appropriate, okay? Mm-hmm. Some visits, you will get poked and prodded. Vaccine-wise, if you need a blood draw, like I said, age appropriate. Mm-hmm. Some visits, you come in, we check your growth and development, do a physical exam, and you're out. So not all visits are the same.
Oh, okay. Oh, easy.
And I do like how y'all said that the parent and the child can come. Because as a mom, it is very hectic to try to figure out your schedule, to make 2 different appointments. So it is nice to come in and we can both just split our ways and come back together. And, not be there all day. So I do like that.
Mm-hmm.
And even with the child care visits, what do y'all think? I know since school's back in session, a big topic schools are heavy on right now is making sure children are up to date on immunizations. What is an easy way that y'all think parents can keep track of their immunization records without having like such a big paper trail? Because I know I've seen parents come in with stacks of paper and I'd be like, girl, you do not need all of that. Like, what do y'all think would be the easiest approach to that?
So some parents are traditional and they have the immunization record that they were given in the hospital when the baby was born. So if you do have that form, we will gladly write those vaccines on there. But in today's age, everyone is bound to their electronics. So we do provide vaccines on our Hilo app that the parents can access to present to child care or to the schools, as well as parents can access their child's immunization on MTRAC, which is a state registry that will allow them to see all of their child's vaccines.
So even if they went to like another state?
Not necessarily another state, and it's all dependent upon that clinic.
Oh, okay.
So,
okay.
I am definitely one of those people who have the little card. I have the little green card, Hep B, tetanus, all that listed.
Yes, I'm a card carrier too. But the system has been very, very helpful. So what vaccines are recommended for starting back to school?
So we have the Dept, so diphtheria, tetanus, pertussis, polio, hepatitis B, Haemophilus influenza B, pneumonia vaccine, MMR, varicella, and hepatitis A before you go on to kindergarten. Now, I don't want you guys to be scared because these were a lot of vaccines. So,
Girl, I got anxiety just listening.
So some of these vaccines, come as combinations. So we have a combination of 5. So we're not going to poke your kid like 7 times in one day. So we have a vaccine, that has 5 of the vaccinations as a combination. Usually, we can always catch you up depending on how behind you are, and we can work with you to see what works. But those are basically the vaccines you need to get. There are also some blood work you also need as well, like your lead screening and stuff like that, your hemoglobin screening, and it all depends on the age as well.
Right, and I'm just going to say those vaccines are given over years. Okay,
Right.
so there are a series. You start at birth when you receive hepatitis B, and then those vaccines are given over the years. So when their child reaches kindergarten, they should already have their vaccines by age 4. But as she said, if you've missed some vaccines, we can catch you up on those vaccines and come to an agreement with the parent as to how many they want to give at each time.
Right.
So it's a shared decision. We don't just tell you.
So is there like a back to school checklist outside of the immunizations that you guys would suggest to make sure that your child is like on track and ready for school, regardless of the age? Or would you?
Yeah, so some things when you're going back to school, of course, you're on summer break. Kids are staying up late, sleeping in late. But when it's back to school time, we should get back in the habit of setting bedtimes, okay? So typically, Dr. O, what do you say for ages, 6 to 12, maybe 9 to 10 hours of sleep at night? And then for teens, at least 8 hours of sleep at night. So getting back in that routine of having bedtimes. Another thing I would put on this checklist, vision screenings, okay?
Nice, yeah.
Kids will say, I can see. But then when school starts, you're starting to see some checks in that homework folder. And it may be that the child can actually see. So getting the routine of having at least a yearly vision exam right before school starts so that your child can adequately focus and stay attentive during class. Another thing we've checked on already, vaccines, keeping up with your well child checks as well. And do you have anything to add, Dr. O?
You said it all. The only other thing I would say, like, your dental care is also important. So we want to make sure you've seen the dentist, you've gotten your cleaning, you want to do that twice a year, depending on, the age from 1 year and above, twice a year. The other thing, we've had, like you said, we've had a lot of diseases. I would say just, making sure the kids know about hand washing. You can also put a sanitizer in their bag, just to make sure, even if they can get to the bathrooms, they can sanitize their hands. So, yeah.
Okay.
Just to piggyback off what Natoya was saying, I was actually one of those children who said they could see. I could see until my mama caught me squinting at the TV. She was like, "Why are you always squinting?" Yeah, I couldn't see.
No, I needed glasses, Coke bottle glasses too. So I don't want to talk about the vision. But I did want to piggyback on your comment and your comment as well. So my daughter, she is not herself. She needs at least 12 hours of sleep before school. Or her whole day is crashing. So I think
12.
Yes. And she's 6, but 7. Oh my God, don't let her hear this. She is now 7. But yes, I think sleep is very important. I notice like her personality, it just changes when she doesn't get a good amount of sleep. And then I know you also mentioned dental. So as a new parent, I didn't know what age they were supposed to go in for their first dental exam. So could you speak a little bit more on that?
Yeah, so the AAP recommends that you go at your once you turn 1 year or 6 months after your first tooth erupts. So I usually just tell my patients at age 1. Honestly, when you go there the first year, usually it's nothing. They're just looking just to make sure. And they give a lot of anticipatory guidance. And the more the kid goes, the more you familiarize yourself, the kids familiarize themselves with the dentist, and they're not getting really scared, But yeah, every 6 months, from then you go in. Yeah.
And it's nice because we also offer dental as well.
Yeah.
Shout out Dr. Patel.
Yes, I'm here for it.
I actually wanted to ask y'all, and piggyback off your comment, Dr. O, as far as keeping your kids healthy while in school. Because we can't be funny, but let's just be real. We don't know everybody's living situation, and we know some parents may not take hygiene and such as serious as other parents. Like my mom, she was extremely OCD. Like she made me like walk around like 10 bottles of sanitizer had touched in my backpack, and I was like, stop it. But what do you think? What are some good tips for parents for protecting children from like viruses and illnesses, especially like during like winter time? Kids tend to get a little more colds and sinuses and things of that nature. Do we have any extra tips aside from just sanitizer?
Honestly, the biggest thing is hand washing, honestly. And, we all know when kids go to school, they share their germs, unfortunately. It will be good, if you have a kid who was sick, you try to keep him home if possible, just so you're not exposing the other kids. But I would say the biggest thing is hand washing, getting like disinfectant wipes to wipe down their surfaces, just make them to get into that habit. Even, once they come into the house, the first thing they do is wash their hands, sanitize their areas. And yeah, that's the biggest thing really.
So we also offer dental as well. So we all know by now that childcare is a total package. And according to the AAP, there are milestone check-ins. Can you guys speak a little bit about that?
Yeah. So do you want to go first? You can go. Okay. So we do the ASQs. We start as early as, 2 months when they come for that visit. We check them, at their 2 months, 4 months, 6 months, all their visits. And then we do the MCHAT, which basically screens for autism. AAP recommends that we do that at 18 and 24 months. So we like to start to intervene, to screen early, because if we notice that something is wrong, we can start to work with the parents early in terms of, referral to early intervention, and then also giving them tips on what to do, like to improve the speech and to improve the gross motor development and stuff like that. So studies have shown that the earlier you intervene, the better for the kids. So, Natoya.
Right, and that's also important with you bringing in your child. So we can't notice those developmental milestones or lags with those milestones if you're not bringing that child in. So it's very important that you bring them in so that we can assess their developmental milestones and make sure they're meeting those goals. And we do have resources for parents if they are behind on their milestones. So we can offer you a lot of things here.
I was actually going to ask y'all. Go ahead.
Also, we now have this screening tool, because I know parents listening to this will probably be like, oh my God, when I come in, there are all these forms. I have to spend like 15 minutes and I have to put that into my visit time. But we have a tool where we can send you the screenings before you come in, so you can actually take your time and do the screenings with your kid, because you maybe watch the kid over a period of a couple of days to know what he's doing, and it kind of shortens your visit time. So we can email that to you for your convenience.
Right, I was going to emphasize it will shorten your visit time if you do complete those beforehand. So
For sure.
that's a plus as well.
Okay, so I know you guys had mentioned the AAP. Could you kind of tell the listeners what that stands for, or any other resources that parents could utilize in regards to their children?
Yeah. So the AAP is the American Academy of Pediatrics. So that's like the guiding body for pediatric care that we try to follow their recommendations, So they have a website where parents can go to actually for some information. We always want you to call your doctor, honestly, because there are no cookie cutter cases. Every case is different. But if you want some information, you could go on the healthychildren.org website to get more information. They have information about dental care, about safety, right? About different things.
nutrition as well. So it's a lot of different educational tools on the AAP website, as well as the CDC. We all know about CDC with, COVID, monkeypox, or what have you, but it also is a good resource for parents when you're looking for what can my child eat. So there's one called My Plate.
Okay.
Some parents may or may not be aware of it, but it's a fun tool for kids so that they're eating appropriately. So CDC is also a good website for parents to reference back to. And as Dr. O said as well, always contact your pediatrician, okay?
I'm going to do our hashtag. Hashtag don't Google your diagnosis, okay? Talk to your pediatrician. It's good to use as a resource, but not your final answer.
Correct.
Yes, because Google will be like, oh no.
Right?
It's over.
Right.
Yeah.
Now let me ask y'all, what advice would you give parents that kind of lost their way, so to say, when it comes to their well care visits? I know there are some parents out there that just do their shots, and some parents, I've seen it firsthand, wait until the very last minute, 8 hours before school starts. I need all my immunizations. What kind of suggestions or tips would you want to recommend parents that are trying to get back on track with regular well care visits? Because I know sometimes it can be hard. They may have to work. They may not be able to get their kids out of school. But what do you think would help to put them back on the right trajectory?
Yeah. So, talk to your pediatric provider. We are always, here at St. Hope, we're open to work with you, honestly. Like I said earlier, we can bring you in, bring your kid in, and get you out in, no time. So you have, you don't have to miss a lot of work if that's the reason, one of the reasons behind you not coming in. We work with you to catch you up, honestly. Even if your kid comes in and has never had any vaccine, that's okay. We can start, from scratch, and then we work with you to see what timing and all of that, just to make sure the kid is caught up before school.
Okay. All right.
And if the reason behind you not getting vaccines, or maybe you had some misconceptions, we can always talk about that too. We can always have that discussion about your fears, your worries. We can provide, educational materials just so you know the importance. Because for me, coming from, a place where vaccines were not accessible, some of these diseases that are eradicated here right now are considered eradicated. We saw some of them back there, So I can as well give you my firsthand experience of what I have seen and tell you certain reasons why I think, the vaccines are necessary, and then we can walk around it.
Okay. Right, and Sean, I know you said 8 vaccines, so we will have a cutoff, and we're not going to give your child 10 vaccines at one time, okay?
That's a lot of crime.
I'm sure the schools can agree, as long as you start that catch-up schedule, the schools will be willing to let the child start. You don't have to get them all at one time.
For sure.
So we work with the parents and, decide, okay, we're going to give this many today, then you'll come back in this time frame and we'll give the next series of these vaccines. So.
And then that'll give them enough time to even research if they have questions about those second set of vaccines.
Right.
And we can reassure them, at their visits, this is safe, this is why we do it. And, if they have any questions, they can call, they can get in contact with us via phone, via the Hilo app. We also have on-call services if it's after hours and it's emergent. We can still provide care for you.
Oh, okay. I'm going to call you at 3 a.m. and say my kid is throwing up. And
Noted, it says emergent. Emergent. Not...
when it's your baby, it's always an emergency.
Look, people don't, any small thing with people's babies, it's an emergency.
Oh, yes. Yes. So it is nice to know that we do offer that service, though.
So I do know one of the things that many parents were facing over the summer was the formula shortage, and it made parents in general just nervous, especially the new parents. So what do you think about that? And do you have any tips or any ways that families can combat what's going on?
This was a big problem over the summer, and still it's still going on. It's getting better, but we heard about kids who were hospitalized because, the parents didn't have enough formula, the kids became dehydrated, or some parents overmix the formula, like, put too much water so it will go around, so that's a big issue. So I'm happy that things are beginning to gradually look up. But what I want to tell parents, so never over dilute your formula, because there's that risk of like brain damage, because it gets really bad. So you want to make sure you go by the recommendation on the can of the formula, and then if you're out of formula, you can always look for different brands. You don't have to stick to that one brand that you were always using. I don't want to mention the brand names because they're not sponsoring us, but you don't have to stick to that one brand. You can always change to like the equivalent, in another brand. If you're not sure what the equivalent is, you can talk to your healthcare provider. If you use WIC, you can talk to them. You can check places like Amazon, to see if you can find these formulas. But for those who use specialty formulas, that's very important that you really work with your healthcare providers, because there's some kids who have allergies and they can't just take the regular formulas. So for those kids, it's very important you work with your healthcare providers, because sometimes we have samples and stuff we can give to you, in the meantime.
And I'll also add to that, I was going to say as well, please do not dilute your formula, okay? And then I was also going to mention that you can use the generic brands. Those are also regulated by the FDA, so they are safe to use. You don't necessarily always have to use, those brand names that we won't reference today. And as well, do not make your own formula. I've seen things on TikTok where parents are making their own formula.
Oh, wow.
Or even giving infants whole milk, regular milk. We do not suggest that as well. So if you do have questions about, which formula to use, always contact your pediatric provider and they can provide guidance for you.
Nice. I didn't know about the over diluted. Like, I was like, okay, because I think just in general you might think like, oh, it's not that big of a deal, or just a little bit. But I can see how over time, if you keep over diluting or trying to make it stretch, it could really cause some issues. So that's very important.
Yeah. It's a reason for the instructions.
Exactly.
So you ladies sound very knowledgeable, and you taught us some things today, so we really, really appreciate it. Is there any advice that you would give people in your field starting out as pediatricians? Let me get the right word. Pediatricians.
Pediatric providers. Yeah. So, I mean, if you love it, you go for it. I did it for the love of it. So, if you love something, you do it. That's like a general advice for anything, right? But you always have obstacles on the way. But just remember, consistency pays. You just have to be consistent and keep going at it. Even when the obstacles come, you have to put in your hard work and consistency. And with that, you're going to meet your goal. It's also a good idea to have a mentor. That's something, even up to this day, I always try to hook up to people who are where I think I want to be, because it's always easier if you don't have to make the mistakes. I mean, you're going to make your mistakes, but it's always easier if you don't have to make the mistakes that someone else has made and the person could advise you against. So look for a good mentor and just, hold on to them as well.
I'm actually curious something real quick. I wanted to piggyback. So y'all are mommies.
I'm not.
You're not a mommy? You're a mommy?
I'm a mommy.
So what would be some things that you didn't know then that you know now that you think some parents would should be informed about? So while you were in school, you have your baby, but then you learn more. What are some things that you even yourself were like, oh, wow, I never knew that?
Yeah, not even being a mom, just y'all taught me some stuff. I'm like, oh, wait.
Oh, Sean, you put me on the spot.
Well, I'm not. Are you ready? Okay.
Well, yeah.
Well,
you don't necessarily have to be mommy to answer. I was just something I'm just curious about. What are some things that y'all are
shocked you that you learned?
Yeah.
I'm gonna have to apply this.
Yeah, I mean, with my niece and nephew, you just get to realize that no kid is the same.
Provider Caston, I know you mentioned earlier that St. Hope offers dental, vision, in the medical care. Are there any other services that we haven't touch that we provide here?
Yes, so we also offer pharmacy services. So if your child, were to be prescribed a medication, you can also get your medication at St. Hope before you leave. And also we offer sick visits. So if for any reason your child has anything out of the ordinary that you're concerned about, we do offer same-day appointments for sick visits. As well as those after-hour calls for emergent and urgent care. So we do offer those services here at St. Hope.
That's nice. I know our main focus was the well child visit because we're headed back into school, but it's nice to know that if you're just not feeling your best, you can bring that kiddo on down.
When they're back to school, like Dr. O said, they're exposed to germs. They share germs, and so they may be bound to get sick. And we also offer those sick visits as well.
So thank you for watching and or listening to this episode of Mic Check 2, a production of the St. Hope Foundation. Please remember to like, comment, and subscribe. For more information about St. Hope or to schedule an appointment, visit our website at offeringhope.org or visit our pediatric website at offeringhopeforkids.org with the number 4. Tune in bi-monthly to hear more conversations about your health, and always remember, at St. Hope, you're more than just a number.